Right, well, this is a bit weird. So this is my fourth webinar, so let's give it a go. And normally there's a bit of an audience, so it's weird to get no feedback, but we will try our best. So I'm talking today, I'm Stuart Rust, a paediatric neuropsychologist at Royal Manchester Children's Hospital, and I'm talking about psychological factors and their impact on adherence and how it affects particularly things like the ketogenic diet. But I also work in my job in neuropsychology at RMCH with epilepsy surgery and metabolic conditions. And so this is something I've kind of bumped into a lot over the last 20 years of my career. So I'll talk to you a little bit about these things today. Normally at this point I do a bit of an exercise where I encourage everyone to participate, stand up in the room and think about the health messages we all know really well and how we all respond to them. So I get people to stand up, ask smokers to sit down, ask someone who's ever drunk more than 4 units of alcohol at any one time to sit down if your BMI is not in the ideal weight range, sit down if you don't get your 5-a-day fruits and veg, which is all the dietitians out there will know is 5 + 2 really, because 2 of them at least need to be greens. And of course sit down if you don't get your 30 minutes of exercise 5 times a week. And the point being that these are really well established health messages. We all know them, but we don't all do them, we don't all live by them. And when we think about adherence, we need to think about real world adherence in our own life and how we're all affected by it. And usually at this point when I do this, no one's standing up at all, although at the Keto College the other year, I think there was one very plucky and possibly wiry OT still standing at the end of this. So I'm talking about the ketogenic diet and thinking about the ketogenic diet, and we know that it's very effective, that it can lead to significant reductions and seizure freedom in quite a big percentage of the children and young people that adopt it. So we know it works. So as high as 55% after 3 months and seizure reduction 85%, they're pretty phenomenal figures. And whenever people refer cases to me, they always say, oh, Stu, you need to help them understand their illness. They need to understand it better and think about it better. And actually, knowing about something, as we just learned with those health messages, doesn't mean you're going to do it. And knowledge of illness doesn't equate to responsibility and skill. And you know, there's a great quote here: the relationship between knowledge and adherence may not be strong as direct as assumed in many theories of health behavior change. Knowing is not doing. We all know we should go to the gym more often. We know we shouldn't eat that whole packet of digestives. We still do it. And as we all know as well, the road to hell is paved with good intentions. And never stop trying to give it a go, though. When we think about compliance, the language is complicated and changes over time. So some people call compliance, that's an older term from the 70s, and adherence, a much more recent term, a concordance sometimes is what it's called. And it's the extent to really which what people do, take the medication, change their diet, follow a lifestyle pattern, corresponds with what we want them to do, what the healthcare provider wants to do, and how they want them to live their life in accordance with their health condition and diet. So in the ketogenic diet, it's about how we can get their ketones up and maximize their dietary engagement. We know that having a chronic illness can be negative for your psychological health. And we know and the research is really well established in this area. Children with chronic illnesses are twice as likely to have psychological difficulties. Mothers of children with chronic illnesses are more likely to have poorer mental health. It's stressful being a parent of a child or young person with a chronic condition like epilepsy. If your brothers and sisters have got a chronic condition, you're more likely to have a mental health condition. This is affecting you and everyone around you. It's not just the child with the condition. And Christine Iser talks about ordinary people in exceptional circumstances, that having a chronic condition places strains that are unexpected on a family. And we know particularly in epilepsy, so you guys will know that lots and lots of money has gone into diabetes and lots of psychological support is going into diabetes, and there isn't the same level of support for children and young people with epilepsies. And you can see that the prevalence of psychological symptoms in children and young people with epilepsy compared to children with diabetes is significantly worse. And, so peer problems, hyperactivity, conduct problems, emotional symptoms, total difficulties overall are significantly worse in children and young people with epilepsy than they are with children and young people with diabetes. But epilepsy doesn't have the same funding or resource to tackle those difficulties. And unfortunately, the chances are some of those difficulties will last for a very long time. So childhood epilepsy is associated with poor general and mental health at 33. So it isn't just for when you're a kid, it's right into adulthood as well. And this is when it's adjusted by cognitive development and comorbidities and anxiety at 11. And of course, having a childhood epilepsy diagnosis means you're less likely to get married when you're an adult. So not only is epilepsy making you more psychologically unwell, it means you're less likely to get married when you're an adult as well. And if we add in poor cognitive development as well, you're more likely to have poorer mental health when you're an adult. So it's something we really need to get right. We need to look at, we need to understand better, and we need to think about more effectively as joined up services. And how does it affect people like this? Everyone gets a bit more stressed. We talked about this. If you've got a chronic condition, the chance of being stressed or anxious increase dramatically. You might struggle with treatment. We know this. That's why we're doing this talk. And that actually sticking to the treatments, the recommendations, it's complicated. It's hard work and it may not feel easy. Behavioural difficulties are a real common problem, particularly in children and young people with epilepsy. Marital stress, you're more likely to get divorced. Not only do children and young people with epilepsies not get married, their parents are more likely to get divorced. We talked about their mental health problems. And disruptive relationships between parents and children with the conditions. And it affects people in lots of ways. When they give you a baby, they don't just give you a baby, they give you your hopes and dreams for the future of your child. And when your child has a chronic condition, some of those hopes and dreams might change. So there might be issues around how the diagnosis was managed and conveyed, about loss, grief for the ideas and the loss of the perceived perfect child, and just how you adjusted to it as well. And adjustment isn't really an on-off kind of thing. Adjustment is something that is a process over time. And of course, families can be widely affected by these difficulties. They can feel shame or guilt. Was it genetic? Was it something we did wrong? Was it something we did wrong in pregnancy? And of course, the problems with attachment. Again, we know, and in my job, I see it all the time. Mums and dads come and see me saying, my poorly baby, there's something wrong with my child. It's more difficult for them. So they can be overindulgent or too tough. And again, that can lead to impacts on behavior and adjustment. Extra attention, medical staff, lots of people around them, they perhaps can be over-familiar with adults. It changes their engagement with their life. There's lots of appointments, dietitians, neurologists, epilepsy specialist nurses, psychologists, educational psychology. There's lots of things that could be interrupting your opportunities for leading a regular life. And unfortunately, psychological issues aren't always prioritized. So families are so busy coping with the day-to-day, getting the tablets, how well is the child, are they experiencing seizures, etc., that perhaps thinking about the wider psychological impact can be neglected. And it's a challenge financially for families as well, because sometimes people have to take time off work and, might have high levels of absence from their job because managing care needs. So it can cause a financial impact as well. It's a big problem. Non-adherence, non-concordance, non-compliance is a big problem. And in fact, in adolescence, the rates really escalate. So about half of all children and young people probably don't do quite what we'd like them to. And when they're adolescents, possibly a bit more. And people pick off and focus on the bits of the regime that they like. So, I can do this bit, I'll do that. Or I can do that bit, I'll do that. But maybe not all the bits. And sometimes those bits don't fit together terribly well. And then, of course, ketogenic diet, it's really important that you get your ketones to a very selective level. So the margins are quite tight. Being a bit selective with it isn't quite as helpful a strategy. And of course, if you don't adhere, you're more likely to have relapses, have breakthrough seizures, and more psychological impact and physical health impact from not following the instructions. It can impact on medication doses. If you're weaning down on a dose and your compliance isn't brilliant, maybe that's not what you want to do. Again, people who don't comply probably have more breakthrough seizures, come to hospital more, might end up more inpatient time. And, you know, it shifts sometimes how you feel about children and families. We all have that family on a case that we think, oh, here we go again. They're struggling, and actually could put a block between you and them and how you engage with them in your therapeutic relationship. And in my job, unfortunately, it's a fairly common reason for referral. Please see this child and young person. They just don't understand their condition. You need to talk to them and fix it, Dr. Stu. I like being called Dr. Stu, but I don't like to have to fix things under pressure. And if we get it right, people go to hospital less often. That's a good thing. That saves us money. But, you know, there's lots of different types of non-compliance, aren't there? And we think of it as one thing. They're not doing it. They're not getting it right. Fix it. But actually, it could be lots of different reasons. So unintentional. There's lots going on in their lives right now. They just can't manage it. Maybe they really don't understand it. Maybe their lives don't facilitate this. They just, you know, can't keep the snacks cold. They haven't got a fridge. I don't know, whatever. There could be lots of reasons. But again, there are people who have beliefs about conditions, and particularly right now with the COVID epidemic, we can be really clear that some people form unusual beliefs or ideas about their illness or conditions around in the environment, and they're not always terribly helpful. I have some friends with chronic health conditions, one who's really shielding very, very, very strictly, who has almost nothing wrong with them. And actually she's, you know, got a bit of health anxiety going on there. Another one who probably should be significantly more strict than they are, but they think, well, something's going to get you. I've got to still live my life. So what you believe about the condition, your vulnerability, your perception of risk is going to impact on the style and manner of which you find it difficult to comply with the dietary instructions or the plan. And we always think, you know, people with the more severe conditions, the worse the problem is, the more likely people are to get it right or to comply more effectively. But actually, so we know from head injury studies, injury severity doesn't predict outcome. From burn studies, the size of the burn doesn't necessarily predict psychosocial outcome, that people with bigger problems can be better adjusted than people with more minor conditions or more minor burns. So severity condition does often go hand in hand with the difficulty in psychological adjustment, but it's not the only predictor, and it's not always the best predictor. So we think from the outside, well, this is very serious, this must cause more psychological problems, but some people are just more robust and can manage more difficult situations. And we know that other things can impact as well. We all have those families on the books that, you know, have lots of problems in their lives and dysfunctions. In my metabolic conditions, I know that families I've had families who don't own a cooker, only use microwaves, and, you know, it isn't going to work. When you've got a specialist diet to try and follow, you need to have cooking skills, you need to have access to resources to manage those things, and the ability to plan and organize diets and diaries. You know, specialist diets, ketogenic diets, metabolic diets, you need to know how to cook and meal plan, and not everyone has kind of got those skills down. Other comorbidities as well, low mood, ADHD, very common these days, unfortunately. Stress and anxiety, common in the COVID period, that we know that levels of mental ill health are probably rising in the community. More people are struggling, particularly as it looks like the social restriction period is going on for longer, that actually people are going to struggle that little bit more. And if they're struggling with their general mental health, well, focusing on your dietary relationship, maintaining appointments, albeit online or from home, poses a new set of challenges, an extra set of difficulty for them. And of course, you know, some of our children and young people with epilepsies, there's a high correlation with cognitive problems. And so that's going to make it more of a challenge as well. Children and young people see what other people eat, they want to do the same, they want to look the same, they want to feel the same. They might understand why they're doing something different. Although potentially not being at school, being at home, there are possibly improved opportunities to improve dietary adherence. I've got a number of families who, with metabolic conditions, have never really managed to get control, but in the period of social restriction, they've managed it really well because they can control other impacts on diet. They're not going to school to steal snacks from friends, and grandma's meddling is finally under control. And when we think about compliance and adherence, it's not just what we think as health professionals that's important. We have to think about what the child wants. Do children really understand? Do they want to do this? Is there something they want to go along with? I'm so glad I'm not a teenager anymore, and I don't have to care or worry about fitting in with peer groups. But children really want to, and they sometimes struggle with, why are you eating a pepperoni at 11 o'clock in the day? But, you know, it's for the diet. Perhaps they don't want to get that to be noticed. Children, young people don't look at, well, if you don't do this right now, that when you're 33, you're less likely to get married. Who really thinks about what's going to happen when you're 33, when you're just a kid? Not many people. And again, fitting in, being a member of the gang, that's the goals and kind of targets they focus on. I feel better because I fit in, not I feel better because I'm getting my ketones right, and that when I'm 33, I'll be probably more likely to get married now. You know, they think about the here and the now a bit more than we do as boring old people. And sometimes they're just in denial, and denial is a really effective coping strategy. Who wants to think about illness and ill health all the time? Nobody does. And actually, so pretending it's not a problem is actually a very adaptive thing to do. Why wouldn't you want to do that? And also, sometimes not following the diet, not getting it right, it inversely leads to significantly more attention and engagement with people around you than getting it right. As British people, we're not very good at noticing when people get things right. When we say, well done you, it's great, fantastic. Actually, when people get things right, we kind of ignore it. Oh yeah, great, we expect you to do that. And so it's the non-adherence that gets people jumping up and down and gets people really focused on seeing you. And sometimes that can be very, very reinforcing for children and young people, particularly perhaps if there are other siblings. It's your opportunity to corner mum and dad for yourself. I'm thinking of mums and dads don't always follow the rules either, because they kind of often think about how they can make it work for them, and that might not be quite the same as what you want it to work like. And they think, well, oh, one won't hurt, or a little crisp won't be a problem, and they kind of make their little judgments, you know, based on whether it results in a 20-minute tantrum or not. And so they don't necessarily have the same perception that we will. And God love our medical colleagues, not always terribly realistic to expect things to happen in a certain way. And so we have to think about, you know, where's good enough? Where does good enough come? Where can we get it right enough that it's balanced? And it's really difficult with a ketogenic diet because, you know, the tolerances are quite tight and you've really got to get those ketones exactly in the right level. When thinking about eating more generally, you know, and any parent will tell you, lots of children and young people struggle with eating. It's really difficult. Parents get very stressed about it. And, you know, estimates in the community of children and young people with eating difficulties, not eating disorders, remember, eating difficulties, can be up to 30%, a third of all children and young people. And certainly around 2 to 4 years when children become hard work anyway. And again, those problems that start early on can persist into adolescence or longer. And again, if you've got a chronic illness, you're at much more risk of getting difficulties and struggles with your eating. So, you know, we've got the complicatedness of eating and feeding your children, a chronic illness, and those things kind of impacting on each other. And when you feed your child, as a mum or a dad, you're not just giving your child food. You're showing the world, I'm a competent parent. I know how to keep my child healthy. I'm keeping my child alive and well. Eating isn't just about nutrition. It's about emotional transaction. It's about eating development, eating independently. Think about all the things you choose for yourselves as a treat. Usually they're foodstuffs, and they're usually delicious and very bad for you. And, you know, children and young people with chronic conditions who might have interruptions to the normal developmental trajectory could potentially struggle with some of those feeding transitions and milestones, and could be missing out important steps later on in their eating development. And it can lead to consequences. So more stress for parents, and particularly if you're introducing specialist diets from a very early age. These are the factors that could be impacting on eating difficulties in children and young people. And you can see there's loads of them. And this is thinking about children just with eating problems, not necessarily with a chronic condition, but although organic conditions are mentioned. So it's an extra complication. So now we really need to think about what we're going to do about it. How are we going to make it better? How are we going to make you guys feel more empowered? And how are we going to help and support our parents and young people more effectively? And I always say to all mums and dads, like Dr. Spock said in the 60s, you probably know more than you think. You know more than you think you know already. Parents know their children most time better than anybody else. So let's really make sure we've understood what the challenges are for them and what the nuances are with their child. Just because they know their child doesn't mean they know what to do to manage them most effectively, but let's let them share what they know about their child. And I said about Dr. Spock already. Many parents cope really well as well. You know, again, while there's lots of risk factors for chronic conditions and complex diets, actually, we all know parents that do amazingly well, which is pretty phenomenal, isn't it? That parents know how to juggle the health service, how to order the things. It's like being a mum or a dad, sometimes it's like running a small enterprise. And lots of parents do that really well and juggle it and manage it amazingly. I know to look after me, and sometimes that feels too taxing. Talked about parents being experts on their children already. And they can become really expert at managing us, about knowing when to get appointments, knowing when they need support, and knowing how to get the best out of the system. And I always say to moms and dads, if you end the day with the same number of children you started with, well done you. I'm not sure they have to be the same children, just the same number. That's a joke, by the way. I'm not advocating switching your children. Not a good idea. And when we think about adherence, then what we need to get is a really clear picture. But remember, we've looked at all these factors, there's so many of them. So to work out where it's going wrong, it could not be one thing. It could be a number of things, it could be one thing. So we need a really detailed picture of what's the situation. Do they understand the treatment? It could be as simple as that. It probably isn't, but it could be. How long has the problem been going on? What's the history? What's the frequency? Has it changed over time? Have you changed other things to make it better or worse? Is this a family that struggle to deal with all sorts of things? Do they regularly not come to appointments? Do they not follow other medications? You know, do this kid not go to school regularly? What's it like in their family? And again, validate where they come from. We all get it wrong a bit. We all make it work ourselves in our own way, and acknowledge it's a challenge. And then can we think about any physical barriers for the family, which isn't just about you telling them what to do, but it's also about getting them to think about how it impacts on their life. Think about how following the diet, managing the child's condition, and what the challenges could be. We know that people who do well, that young people who do well, are optimistic about themselves and their lives. I can do this. I've got this condition, so what? It makes me richer, not poorer. It makes me more interesting, not something to be ashamed of. We need to own ourselves a little more and be a bit more proud of who and how we are and the way we're different. We need to all own our differences and acknowledge that, make us broader, richer, more interesting people. And people who are really quite good at self-monitoring, in control, can kind of regulate their emotions, problem solving generally, they're the guys that do very well. So let's promote their problem solving. We know that mums and dads that do well have someone to talk to. Lots of research evidence all the time talks about the importance of a confidant. Have you got someone, particularly for mums, have you got someone who kind of knows what you're going through, can understand it a bit, and you can offload to, possibly over a glass of wine or two. But remembering compliance rules and not having more than 4. And we know that mums and dads need to look calm, even if you don't feel it. And my colleague, Sam Cartwright-Hatton, who's a professor of anxiety in Sussex, always talks about faking it to make it. Even if you don't feel calm, if you look calm, half the battle. Stability and structure and routines are really important for children and young people, and they're super important for children and young people with complex conditions. And so actually, as you know, with the diet, you have to get the ketones right at the right times, and you have to have the supplements ready, or your emergency snacks or whatever, so that you can deal with those moments and you can keep things going rather than relying on what's out in the shops where you might struggle sometimes. But so structure routines make things better and help parents feel more confident and make children feel safer as well. And again, in the family, it's not just mum's job to do this. If there is more than just mum, then actually families that do better share organisation, share management of the condition, are cohesive, talk about things openly, and exchange responsibilities. It's not just one person's problem. It's not just the child's problem. It's not just the mum's problem or the dad's problem. It's a problem they're all going to work together to resolve. And maybe not even a problem. It's just a thing that requires us all to be in partnership to make better. We know that peer support is really important, that children and young people have someone else that can have the condition, someone else knows what they're going through, someone else who can recognise you might be a bit like me. So actually these days there's a Facebook group for everything, great for mums and dads, sometimes computer networks, sometimes they are moderated, and it's important to choose those kind of ones. And similarly, the BBC do some amazing things about acknowledging and sharing medical information. There's a program called Operation Ouch, and things on the internet, on the BBC sites, that are just so informative for children and young people. That help them feel included, validated, and normalize what's different or special about them. And there are lots of expert patient programs and workshops for young people. Our hospital has an expert panel of young people that we consult. So all these things exist, and so hopefully they'll be starting to build up in the ketogenic diet network as well. What do you do when you see someone in clinic who you're struggling with? So this is the nitty gritty, probably all the bother bit you sat through. You knew that you want to know what about this bit. Be honest and praise families being honest. Thanks for telling me you're finding it really difficult. Thanks for sharing you've got it wrong this week. Thanks for being honest about it. The more honest you are, the more likely you are to be able to work out why it's such a struggle. And when you can validate that, if parents are lying, no, I do everything the way you say, I don't understand why it's like this, you're not going to fix the problem. You're not going to move it forward. So praise really being honest. Try not to blame people or label people. It's really difficult to get those kind of barriers set up between families. They're not doing it. It's this family again. Here we go, round the circles. Try not to blame families, and just think about, it's really hard work. It's hard work being a parent. It's hard work feeding kids and getting them to eat what you want them to eat. It's really much harder when you've got a chronic condition in tow. And explore and understand where things are going wrong. So tell me how you go about setting your meal routines, or tell me what you do, how you prepare meals, or tell me how you plan for the week. So you can get them to be really open and honest and think about where the gaps might be, where the lapses in compliance. Get them to ask questions as well. Well, I like people to write down things between sessions. And in this funny old time when everything's online, I am very comfortable with patients emailing our service with their questions, which we then go through in our next session. And I think this is great. The next thing is about communication. We take it for granted that everybody can read and read to the level that we can read at. And unfortunately, in the Northwest and in England, that isn't always the case. Now I have lots of children, young people and families with significant literacy impairments, or English might not be a first language. And sometimes people can be really good at satisfying, and actually it hasn't gone in, they haven't really understood it, they don't know what's going on. So you might sometimes need to just carefully check out do families understand things. And again, in this day and age, really be careful where people are getting their information from. While it's great there are peer support networks and information sites on the internet, they don't always say what you would like them to say. So really perhaps check out what it says. This person said in the Facebook group, such and such, and that may not be right or true. And do people really understand what to do and what will happen if they don't? It's about helping them understand what are those intentional non-adherence factors, what are the things they just want to compromise on, what are the things they don't understand or they've made errors in their understandings. And finally, praise achievement. Build on what they get right. You got here today. Hooray. I'm really great. It's really great to see you. You got 3 days where you managed it. Brilliant. Fantastic. How can we get it better? And so be really careful with our language. So there's lots of experiments that have been done looking at compliance. And apparently just something as simple as asking parents to write down the appointment, asking them to put it in their phones themselves rather than giving them point cards, makes it much more likely they're going to come to the next appointment. Brilliant. Communicate. If there's more than one person in your team, they speak to you, maybe the neurologist, or you are the neurologist and the nurse. Is everyone on the same page? Are they all giving the message in the same way? Again, differences between teams can leave patients being confused or trying to follow a middle way and making a bit of a fudge of it. So, check that out. I said before about routines, and review medications. Keep making sure they're, when people go into the diet, sometimes people can just decide, right, well, I don't need medications anymore. As you all guys all know, not necessarily true. And they need support and guidance to manage anti-epileptic medications. They're not a trivial thing. Yeah, so I said before, don't tell people off. Don't point and poke or lose your patience. it's really hard working with children and young people, and they can be frustrating. And, you know, try and be cool about it. And don't exaggerate the consequences. If you don't do this, you could die. Now, we know in epilepsy, SUDEP is a risk. Fortunately, it's super, super, super rare. It is a risk. But we're not going to tell people if they don't do this, they'll die tomorrow, because they probably won't. And then you'll look foolish. But you're far too sensible to do that anyway. And I like motivational interviewing approaches. I know it's very popular with dietitians these days, and it's very popular with everybody. In fact, it's a great idea. So, you know, have empathy and feeling for your clients, and support them for thinking about giving in change and a diet a go. Try and identify where they want to be and where they are right now. What's stopping them from getting to be the person who follows the diet perfectly and manages it really well all the time? Where are they now? Where do they want to go, and what's the gap, and what can we do to try and close that gap? I said before, and I've said it several times, Miller and Rollink in their motivational interviewing early research say, roll with resistance. Don't push against it. If someone gives you an argument, say, oh, you know, validate their point of view. Don't argue with them, but see if they can come up with an alternative point of view. And in the words of Trumpists, are there alternative facts to the ones they take as sacrosanct? Could there be another way of looking at it? What would someone else in this position say? Try and see if they can wobble that kind of certainty, and rather than challenge them directly, posit other alternatives. Again, have they made changes in their life before? Have they done other things? Have they managed to get their medication compliance perfect? Have they managed to lose weight in a diet? Have they had other occasions when they've been effective? Have they managed to learn French online using Duolingo? Well done them if they have. And autonomy, you know, people have to own this, that this is often a lifelong, long-term thing, certainly, and in some of our dietary conditions, a lifelong thing. And if it's long-term, you know, people have to own it and make it part of themselves and their routine. How could they change things? How could they make it better? Rather than us always having to come up with suggestions, what can they come up with for themselves? I like rewards and star charts with young children, and actually sometimes for ourselves, rewards can be nice too. If I get this right, I will treat myself to X, Y, or Z. Let's face it, I only come to work because they pay me. That's a reward, isn't it? So it's a way of encouraging compliance. Again, charts are great, but don't we all love a surprise? If someone surprises you with something fantastic, you know that's going to stick in your mind more. Not unrealistic and stupid. If you do this and manage to get your ketones right for a week, I'm buying you a Ferrari. Probably not going to happen. Probably not going to encourage much compliance or improvement. And if they did, you ain't going to buy them a Ferrari anyway. And again, you need to see what you want before they get the reward. The number of times I see mums and dads saying, if you do this, you know, here is a lolly, do this for me later on. Well, I've had the lolly. I'm not going to do what you want now. Thanks for that. And I like star charts as visual, but they are difficult to get right. And I see lots and lots of star charts that are very, very, very wrong, not incentives, and in fact can be disincentives for children and young people, you know, with 32 different goals in 14 different colors, far too complicated, and I like very simple things with one goal at a time. A bit of a case review. GLUT1, as you know, really responds well to the ketogenic diet, and we know it's really important that they stay on diet and don't come off it. And this is some stuff from our dietetics colleagues. And this young person, she really wanted to be, I want to be the same as everybody else. I want to fit in. I want to be off the diet. I want to eat normal foods. And so we had lots and lots of dietetic support, lots of clinical psychology support. So she was super honest, and actually it was really important that we say, thank you for telling us the truth, woohoo! And we allowed her to communicate her concerns and anxieties. We focused on them. We validated where she was coming from. We looked at what she'd done that was achievements and successes, and found out ways to work around it and make it work a little bit. Mum got involved, obviously, of course she did, gave us some decisions about what foods to eat and when, gave us that sense of control. And apparently at the last review, confident, came without mum, managed on her own, engaged with the team better, updated about her diet, doing really well, managing her own diet, and yay, didn't ask to come off it. So that's a real success. And then an 8-year-old, developmental delay, learning difficulties, lots of medication, still serious seizures, educational regression as well. So, you know, a really worrying situation, really concerning case. And her mum ambivalent about whether she could do it, you know, because it's complicated and hard. And worries about fussy old fusspots that children can be. She likes these things, she likes that. And as we said before, feeding problems are really common. But we validated it, worked with mum for several weeks before the diet, helped her understand what it was going to be, what it would avoid, try and avoid aversive feeding practices. We know forcing, we don't want to do that, it just makes things worse. Lots of positive feeding behaviour, lots of rewards that are not food-based. We all need to get better at that as well. And family meals and a family approach. And apparently this young person was doing really well, wider choices on high-fat foods, stepwise introduction, new rewards that weren't always about foods, and some alternative food-based treats using a wide range of recipes. You've got to be able to cook to do these things successfully. And we always praise parents' steps and achievements along the way. We love them to ask loads of questions. We try and not offer solutions, but work together to find solutions and acknowledge slip-ups. Everyone makes mistakes. Everyone doesn't get it perfect all the time. And we work together and have a supportive network around the family and young person to achieve the goal. And the family managed to go to Disneyland Paris. Woohoo! They did 2 years of the diet with good ketosis. Woohoo! Although they did have to go to a puree diet. But they managed it really well, and seizures improved dramatically, and that mum felt much more confident, and actually now is a bit of an advocate. Yay, that's a real sign of success. Not only is that mum managed it for herself, she's now advocating it for other people. She's become a convert. Fantastic. So I'm going to end here, and that's probably bang about right time-wise. Dietary regimes are complicated, and perhaps we don't always acknowledge how hard that can be for families. And sometimes it comes from a simplistic point, like, oh, you know, I don't understand why you can't get it right. With complex conditions and epilepsies, there are lots more psychological challenges, making it even harder to get dietary conditions and management right. Adherence involves everyone in the family, and you need everyone on side to support and get the best outcomes. And we really need to be there alongside and supporting our families and their cheerleaders for the times to get it right. And sometimes change can be slower than you'd like it to be, but lots of people can get there and do really well and make it work in a good enough way. And that's all you really need. Brilliant. I will end there. Thank you very much.